Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callendar.
I introduced myself as Gloria Nurse, and my reason for being here this morning is because Dr. Callendar did ask me, as one of the first people to be receiving the vaccine. I did a trial test in September of this year, and I wanted to speak to you about it. I don't know if I do that now or should I do that a little later or
Now,
what? Clive?
now,
Clive?
Do it
Now.
now.
Well, I guess I'll go ahead.
Yeah,
Now.
go ahead.
Oh,
Yeah.
okay. I hear you. Yes, I understand now. Yes. Okay. I was raised in Harlem about 75 years ago. And at that time, I inherited a disease known as asthma. This asthma came through my mother's side, and I, as a little baby, struggled with it. And I also caught tuberculosis. Where I caught it, I don't know. But both my mother and my mother died of asthma and my father died from tuberculosis before I was a year old. And I came and I lived with Clive, and I was better known as the baby then. And I was well taken care of, loved, and looked after. Whether I wanted to be looked after or not, that was important, because as a sickly child, I needed all the attention that I could get in order to get to 75 years of age. God had a plan and a purpose. And at that time, as a struggling child, I did not know about any plans or purpose. All I knew was that I wanted to go out and play, and I was unable to. Because my asthma was so bad, I also got other diseases that went along with that asthma. Some of you may know it as eczema. And in those days, they had no cure for asthma. As a matter of fact, when you would go to the doctor, they would tell you that it was psychological. And that in terms of my eczema, it was so painful that I was hospitalized 10 times for it. And then by the time I got to the third, fourth grade, I missed a whole year of school because I was unable to walk. My fingers, my neck, my hands, everything was just horrendous. That's the best way, horrendous and in pain. And so between that and my asthma, I missed a lot of schooling over the years. But I'd like to say that in the midst of all this, God had a plan. While I wasn't raised with my mother, I was raised with my great aunt, who took care of both me and Clive. And she was an older woman, and she provided for us how she provided. The ways and the means are beyond our comprehension, because it was an act of God's grace in our lives. We were not rich by any means, but we didn't grow up thinking that we were poverty stricken. We grew up knowing that we were cared for. We also grew up knowing that God provided for us. There was none of that that was etched in my mind that I'm going to starve to death. And for me, growing up with these diseases, because I spend so much time alone and at home and being sick and being in pain at times, because with the eczema, it's one of the most painful diseases that you itch and you scratch all the time. And not only do you scratch, but there's blood and gore, just horrendous way to look at sores on your body. And as a result, going to school, kids sometimes didn't want to be near me. And when I had the asthma, I could barely breathe to walk, but nevertheless, I persevered. And that's one of the things I learned as a child, to go ahead and persevere no matter what. And the most peculiar thing in persevering is when I would explain to children they didn't want to come near me because of my skin, they didn't run off. Surprisingly, once I explained, trust me, I had to explain all the way through high school, was that this disease that I have unfortunately makes me have skin diseases. And because of the skin diseases, you're not going to catch it. You don't have to touch me. But that the fact is that, you know, this is here, this is who I am. I'm trying to struggle to get to school. And they were always supportive of me. There were people who knew I could not climb steps very well at school, and they would take my little briefcase and help me along the way. It was during those times though, that my faith in God began to grow. Although I was little when I was ill on the by myself in the bed during the day, I remember having an experience with God. No, I didn't see him. He didn't come in purple robes or anything like that. I didn't see wings, but I felt a sense of God's presence. I felt that sense telling me that he cared for me and that he loved me. And I was developed with that. And that gave me the strength to persevere for all the rest of my life. And so when I had all these illnesses, being taken to the hospital, being taken to the emergency room, being looked after, there was always that sense of God with me. And that is the promise that he's given to each of us. And I knew that, you know, God was with me. And so a lot of fears that would come to you as a child that were that, you know, that's a part of growing up and living. I can honestly say I didn't have those fears, but I did
Time
know
is of
one
the
thing.
essence,
I wanted to
Gloria.
live and I wanted to play and I wanted to read and I wanted to be a part of life. And so that's one of the reasons I persevered. As I got older, I wish I could say that my asthma decreased. No, if anything, it got worse. And it got worse for a number of reasons.
Could you tell us
And
about the vaccine?
but even so, even when I would get pneumonia, even when I would be hospitalized, one of the things that happens, you waste a lot of time in doing your schoolwork. And then as I became an adult, it also affected your work habits.
Tell us
Because
about
if
the
I got
vaccine,
sick,
please.
very, very sick, and I was in the hospital a long time, at that time there were I took other vaccines for asthma. I took other medical. I was in other medical groups. When I began to take the vaccine for the COVID-19. I talked to Clive about that and I did my research And I knew that Black people who were older were needed in this vaccine. Why? Because when we were older, it was affecting us more than any group. And I thought about it, I prayed about it, I did my research, and they were asking, other African American doctors were asking for African Americans to participate in this vaccine. So after doing all of that and even reaching out to NIH and John Hopkins, I did not hear back from them. But I went on, and as I met one day with my asthma doctor, I told him that I was interested in being a part of it. And he went out of the room with his assistant, came back in with the gentleman who was the principal investigator for the vaccine. I went on, and that same day that I came to my doctor, I received the vaccine. And while it was very quick, the fact of the matter is I had already prepared and done my homework. And once I got the first vaccine, the vaccine did not hurt. There were no issues with me for the first vaccine. About 3 weeks later, I took the second vaccine. The second vaccine was a little bit different. As soon as I got that shot, I felt a headache immediately or something around my head. And I thought, well, maybe it's because I had an Eden. And then it was when I learned that, in fact, that people do get headaches. And that night, as I came home, I proceeded to get a fever. I also got pain. And when I got the pain in the middle of the night, it went from my toes all the way to my fingers. And I'd never had the flu, so I didn't know these were flu-like symptoms. And in the morning, that night, I asked Clive, please call me in the morning because I want to make sure I'm alive. And so he was generous enough to call me at 6 a.m. I did not feel good the first day. It was horrible the first day for me. And then by the second day, the fever began to subside from 102, and it went down to about 199. And then by the third day, I began to feel better, and I was able to get up, eat, and do what I needed to do. So here we are about 3-4 months out. Do I have regrets about doing it? No, I have no regrets about doing it. As a matter of fact, I feel safer for having it, and very grateful that I had the ability to think these things through and go other Black people that will be saved if they lend themselves to not staying wrapped up in the past. By staying wrapped up in the past, I mean, there are medical disparities out there, but we've got to move on as a people of hope and a people who employ our Christian values to realize that we walk by faith and not by fear. And so out of that faith, I went ahead and got that vaccine. And I don't know if you have any questions, if Clive will allow me to answer questions. I generally do as I'm commanded at times, but if you have any questions and Dr. Callendar allows you to ask them, I will gladly answer them.
I don't know why you're trying to depict me as a...
Okay, there doesn't seem to be any questions.
Yeah, I want you to
Clive, it's back to you.
Yeah, I want you to take questions. The floor is open for anybody who wants to ask any questions to Gloria.
I have a question, Dr. Callendar, for Gloria. Where did you get the vaccine? In the hospital or a clinic or a CVS? Where was it?
No, the trial vaccine was given at George Washington Hospital. It began in August, and I was a part of that.
Oh,
I had a quick question. When you talked about pain, what kind of pain was it? Where was it located?
The pain after the second injection went all the way down from it went through my body, but it was really primarily in my legs and the arms down from my fingers. And I woke up in the night with that pain. And truly, by the morning, it was gone. I didn't have any more pain. It was just that first night. And the heavy fever came that night.
I have a question. So are you saying that you had the coronavirus for one day?
No, no. What I'm saying is that, no, I didn't get the coronavirus, but as a result of what the injection was, that whatever was in the injection, for some people, this is not for everybody, they get very tired or they get a headache, and there are other issues that people may have, but I did not have the virus, no. While
Okay.
the virus, I'm sorry?
I said it was just a side effect from the injection.
Definitely. Yeah, and it hurts at the site where you got the injection. My first time, no, I didn't have any pain. The second time, just very slight pain at the site of the injection, and it was red, but that was it.
I have a question. Did you have any respiratory symptoms like congestion?
Well, that's one thing that I thank God for I did not have. That's the number one question. Did I have any asthma or did I get any bronchitis or anything? Absolutely not, nothing.
So another question. So was the second injection different from the first injection?
Absolutely.
Okay.
The first injection, I had no side effects. The second injection I did, but the side effects were worth it. They were minor. And I would say for anyone thinking about getting it, is the one thing sometimes doctors don't want to do is prepare you for what's going to happen to you. And I was prepared to a certain extent. I was, because I'd never had the flu, when people say, well, flu-like symptoms, Clive had told me what flu-like symptoms were because he's had the flu. And so I wasn't prepared to wake up in the night with this, but be that as it is, it wasn't anything to it. So take aspirin before you go and take aspirin after you come back.
I have a question. You said after the second injection, you had was it a severe headache or mild headache?
A very mild. I knew that something had immediately after the injection. I knew that something was going on in my body, but I thought that I hadn't eaten that morning and I knew I was going to take my blood. So I thought it was just a lightheadedness from not eating. But if you're sensitive to things that are going on in your body, you will feel some things. And I was, then after that I ate, and I must admit they gave me some food. After each injection, you have to stay for a half an hour. They will not let you out of their sight. Because there are some people who have been known to have anaphylactic shock. I have all these allergies. I did not have any allergy attack. And so yes, that came immediately, the headache. And then after that, when I went home, I was fine until that night about 7:30.
Okay, thank you.
And there's a diary that they give you, a telephone diary, where you had to put everything down that's going through or going on with you. And as a result of that, they keep up with you and your health. And there's a 24-hour call number. And I was able to speak with my doctors, and they call back immediately. And so everybody did what they could do. I didn't know if I should have taken any Tylenol. And so I asked them, and they said, absolutely.
I have a question. Did they tell you that you're getting the vaccination or the, what do you call that? Something else, you know?
Placebo.
Placebo, right. Did they tell you that?
No,
It's a two-part
no,
question.
no.
So you
don't
didn't know whether
know.
you're getting, I'm sorry, go ahead.
Sorry?
Uh,
No, I didn't know whether, in the beginning, I didn't know whether I was getting the placebo or actually the vaccine. They don't tell you. And so I really did not know what I got. And when the pharmacist came to inject it, I realized the doctors don't even know what you have. But the pharmacists and all of the people involved keep a strict record. And then by the time I got my second injection, we all realized that placebo will not do what the vaccine does. You would not get a fever from the placebo. You would not have the pain from a placebo. So actually, I did get the injection.
Oh, so now you don't have to take vaccination, right? Since you already got the vaccination.
That's right.
Oh, okay.
Quick question. Have you had a follow-up on the antibody tests or your levels of antibodies?
I go every month and they take my blood and everything. And I just, I took the flu shot even after that. And they're very quiet about what they'll tell you. We're having a meeting next month, and so I got a letter from them Tuesday. And I understand they still want to continue with testing for some of us. And I'll see what that's about. And because the tests are going on as we speak right now in children, because the children were left out. So they're starting on them starting at age 12 and up. And even today, Moderna is meeting today to make sure that they get the FDA approval, and hopefully they will, and that their medicines will be out on the road by probably Saturday, Sunday.
With your side effects, were you bedridden or could you still function, and how long did they last?
In the first shot, no, I wasn't bedridden. I just went about my daily life. The second shot, yes, I was. The first day was horrible. I didn't feel like doing anything. I felt very weak, and as I said, when I woke, the pain was gone, so the pain did not bother me. And then by the second day, you're able to get up. I mean, you're not going to run a marathon, but you feel a lot better. And that was just me. Now, there are others, I imagine, who were not, like I had no issues with the vaccine itself. I wasn't allergic to it. Others can be. I had no respiratory issues. I had nothing. Yeah, so by the second day you get up and you function Not at 100%, but definitely by the third day, you're fine. And I understand in the warnings, they are telling people, you know, to take the first day off from work if you're working and to be prepared.
What led your decision to take the Tylenol before and after you got the shot? And taking the Tylenol, did that build a shield or help you during and after you took your shot?
No, I didn't take the Tylenol before I got the shot. I took Tylenol after I spoke to my doctor because of the fever. And they were the ones to give me instructions to take the Tylenol. Yeah.
Thank you.
Okay, I have a question. Were there doctors and nurses, just in case if you had some kind of reactions, to give you something right away, like Benadryl, epinephrine, or something like that?
Yes. Yeah, they were there. That's why you stayed a half an hour. They keep you for a half an hour after you get the shot to make sure that everything is okay. If you're going to have an anaphylactic attack, you generally get that right away. With my asthma, I didn't have any of those, but that's why they keep you.
Do they tell you not to eat before the injection?
Did they tell me what?
They tell you not to eat before the injection.
No, actually, it wasn't anything to do with the eating. I thought because I was taking blood as well, they take about 8 tubes of blood. I generally, when I am giving blood or having blood taken from me, I generally know not to eat. That I did on my own, but I could have eaten.
Do you think not eating would have made you weaker and more prone to maybe a fever or something happening?
Well, trust me, when I came home after I had the shot, I did eat. I did eat, and so I don't think that had anything to do with it.
Okay.
That's what I initially thought, what you just said. But no, what I felt was that light headachy component in my head and like a rush or something to my head. No, that didn't have anything to do with not eating. But I would suggest that everybody eat before they go.
Yeah.
I'm sorry.
Yeah, that's what I was going to ask you. Thank you.
Okay.
What is the exact name of this vaccine?
Moderna.
I took the Moderna.
One more time.
Moderna.
When two people speak, you give me the answer, then I can't hear it.
I'm sorry.
One person tell me the name of it.
Yeah, it was the Moderna vaccine.
Moderna. Okay, thank you.
Yeah.
Do you have to take 2 times this vaccine also?
Yes.
Yes. You take it about 3 to 4 weeks apart.
Wow.
There's no difference between first and second shot physically, is there?
Well, yes, that's what I'm saying. For me, there was. The first shot, I had no issues whatsoever. And the second shot was where I had a little more issues.
But that was your reaction. I'm just asking you physically, is there any difference between shot 1 and shot 2?
The shot itself?
Yeah.
Yes.
I honestly don't know. Yeah, I don't know if there's more vaccine given to you. I don't know.
Okay, thank you.
I'd like to ask Dr. Callendar, in general about vaccines, and generally speaking, what is the difference between, what is the reason for the 2 shots separated?
The first shot, immunity is associated with a first shot being to develop your immunity. The second shot is a booster shot. And that's when you really get the reaction and the benefit of the first shot.
Okay.
So you must have that second shot. But as she said, the reaction that you get is intensified by the second shot. Even though it's the same medicine, the fact that you get it again heightens your immune responsivity. And that's why the second shot is when you get the symptoms.
Okay. So now I
As
understand.
contrasted with the people who have anaphylactic reaction, because the first shot, they are allergic to that because they've already had a priming, because they're already predisposed. So for them, the first shot, you get anaphylaxis. That's a separate issue.
I think one of the things that I've heard most in the field, a lot of the skepticism about taking the vaccine is still going back to the Tuskegee study. You know, are we being given live virus that's going to cause the illness, or is this something that's going to really to help us develop antibodies so that we don't get the virus? And as I understand it, this is not a live virus. It's something else that attaches to the DNA or the RNA that helps the resistance. Is that correct?
Yeah, it's a protein that attaches itself, and that protein begins to create the antibodies in you to resist that virus.
So we should not be afraid of a Tuskegee effect, and that should be one of the messages that we carry to the community.
Well, it's not, I mean, we all have other issues with, you know, poor medicine as African Americans, but the fear should not overrule the fact that you want to live. If you really want to live and have a healthy life and not live in the emergency room or anything, you will take that shot. If you don't, then that's your decision.
And I think
I took it because I knew I wanted to live. I also knew that I would be primed to die if I didn't take it.
I think that's my point, and I think everybody on the call is an influencer in some orbit, and I think it's a messaging around you know, how we present it or how we talk about it that's going to be really important.
Yeah, it's vital to us. I definitely knew about Tuskegee and other issues and the disparities, especially with us as African Americans. But even in weighing that, I had to look at the fact that this shot created today in 2020, there are more Black people who are scientists. There are more Black African American people who are doctors. And the fact that the med schools, the 4 Black medical schools, and they asked for us as African Americans to be participants. And one of the things that they did is they stressed the point that there are more African Americans in medicine today than there were at the time of Tuskegee testing. So it is really important that the doctors, the African American doctors, have a lot to do with this and getting the word out there and ensuring our people that, yeah, you may get a little bit sick, but this is no longer, you know, 1947. And we've moved a long way, and there are people who are attempting to safeguard you.
There's another issue also. It's the same vaccine for everybody. You know, with Tuskegee, there was a specific subgroup that got that particular injection. It wasn't given to the whole country. You know,
That's right.
these vaccines are given to everyone. So that's, for me, that's the background that I want to give everybody. It's not specific. There's no way that they can discriminate or discriminatively give Black people a Black Moderna or a Black Pfizer vaccine. It's no color to that vaccine.
And that's the point I was really making and what I was saying. Yeah.
Yeah.
One question.
It's a global issue, and I don't think we're interested in killing off human species.
Yeah.
And that's why we're fighting against it.
Right. And now, yesterday, almost 4,000 people died, COVID virus. Now, the president of the United States, Dr. Fauci, said should take it. And he doesn't want to take it. That is his, as president, it came out. So people are doubting, why is he not taking it, and the top guy is telling him to take it. So
because there are things that the president does in private that he's not going to be public about. We know that he's a germophobic. We know that he does not like to do certain things publicly because he's more interested in getting an audience and getting the money from the audience. And that is his primary purpose. One of the things is that he already got infected, and we understand this morning that Mike Pompeo was supposedly around people who gave him the germ. So it's not saying it's, whatever they do, they're going to protect themselves. Giuliani called it last week. Because he was a celebrity, he got the top tier of drugs. I am quite sure the president will do whatever is necessary for him to do. But he's attracting an audience by not taking it or claiming not to take it.
Yeah.
I have a comment. And I guess we would need Dr. Robinson, but Dr. Callendar or Dr. Walton, you can answer this. In psychology, what helps alleviate people's fears? Is it an eyewitness or a person that's actually gone through it like Gloria? Because even though when people are presented the truth and etc., they still have fear. And we can do a lot of things. Some people, they'll tell me this, and even after you present the facts and try to be logical about it, in essence, they will still have the fear. So is this a good thing, like what Gloria is presenting to us, and we would show this to show this one person, with all of her illnesses before, was able to survive and tell you this. Will that still be able to help people alleviate their fears? Like I know, Dr. Callendar, you went from place to place and you emphasize about even donations, about transplants, to get away of those preconceived notions. So maybe this is a good thing if we can get people to watch Gloria, or does this actually help? Because, even taking the flu shot, Dr. Callendar, the people, they had all the knowledge and etc., but they still were adverse on taking the flu shot. So I would like to hear some comments or response to that.
Well, as usual, Carol, you're on target, and I think. And I think, I'm sorry, John, but as usual, Carol is on target.
Oh my goodness.
And I think that this is the first of many ways in which Gloria can help the rest of the community to recognize that to save their own lives, this is something they should do.
I think it's also going to be important as we get the message out, to look at where we get information and who provides it. And often in our community, it's not the same as it is in other communities. So we listen more to people that we trust. people like Gloria, people like Dr. Callendar, even in barbershops, beauty shops, nail salons, churches. I mean, those are going to be important avenues of communicating the safety of the safety and importance of the vaccine. I know I was going to have it, but I was ready to wait to take the vaccine until I talked to Dr. Callendar. And when he said he was going to be among the first to get it, I said, okay, if he's going to do it, you know, I'm ready. Because he's an influencer, you know, I trust what he says. So I think that that's important, that we hear the message from people that we trust. And those of us who've had the benefit of hearing Gloria's story can go out and share with the people with whom we come in contact with.
Yeah,
because it's important.
I also think one thing is that the reason that people don't always want to take vaccines, and you can present the gospel of Jesus Christ to them. It's called free will. You can present them with all the knowledge, but we still have free will to make a decision, you know, to be proactive about our life or not to be proactive. Many of you made a decision to be proactive about your life and not live in fantasy about I don't have the disease. And so we'll do all that we can, all that we can bring to bear. I will honestly do that. I told Dr. Callendar about me getting a text the other day at a little bit after 7 in the morning. And I realized that people trusted me for a number of reasons. They knew, some of them didn't know until I told them my background in my illness. A lot of them did not know. Those that did know, who'd been with me through the journey, was like, if you did it and you survived, then I'm gonna survive. And so it is up to us to be, the new word called influencers in this generation. And we all have a story to tell. I mean, I told my story, but you have a story. Every single one of you told your story, and that influences your next door neighbor. I may not be able to influence the world, but the little portion of the world that God has chosen to put me in, I will do it.
Moving forward, are you going to continue to wear your mask?
I'd also like to say something else. You're a very powerful group. You're very powerful because each of you, if it wasn't you, there was a loved one that you had, that you were involved with, and that you were caretaking for. I have to. I have to wear my mask, wear my gloves, wash my hands, and stay away, you know, try to prevent myself from, you know, getting other people sick or them getting me sick or whatever, because we don't know how long this medicine is for. We don't know if the vaccine will last a year. We don't know if it'll last 3 months. There are things we don't know about. Yes. Yeah, I will do that.
Yeah, I agree that in the Black community, fear of the vaccine is probably a primary issue with us, because we're skeptical about, you say we don't know what's in the vaccine, whether it's going to hurt us. We want somebody else to go out to see if it kills them first before we get it long on the back end. And I agree with what Flavia said, that our primary influences in our community are pastors, barbers, beauty shop owners, and we need to. They're primary influencers. If we could even contact them, you know, to set aside some of the myths about the vaccine, get them on board, and so they get more people on board. That's very important for our community.
And I think what's more important, last week they spoke of a female Black doctor who was involved in the development of the vaccine, and that was in hopes of changing some of us Black America, changing our minds into going ahead taking the vaccine. However, in hearing Gloria's story, especially the health issue prior to the vaccine, I think that will have more of an impact to convince someone, yeah, maybe I can do this too. So we need to hear more stories like that. What you said, the way you presented it, it needs to be out there. We need to hear it.
I have heard, and you can tell me about other things you've heard. The media, most of the time, really helps. But when they present adverse reactions to this vaccine and things that calamity or something happened because somebody got the vaccine, they are really hindering people from getting it, because they'll take that one instance that one person got an adverse reaction or an allergy, and then it was an allergy and something else that happened because of the vaccine. Does anybody remember?
The anaphylactic shock.
Yeah. Allergic, these are people who have allergies to vaccines. And if you have an allergy to a vaccine, you should not take the vaccine.
Right.
Yeah.
But something else that happened by somebody taking the vaccine, I forgot.
Well, there, Bell's palsy. There were 2 people in this study that came down with Bell's palsy, which is a paralyzing of the facial muscle. And the trial that is facial nerve. And they were on the placebo, so they had not taken the vaccine, but I did get a call before I came on this morning from one of the networks that is going to interview me, and I hope to get the word out there. Ms. Tatum, the person that you're talking about is Kizzy Corbett. She's at NIH. And she's a young African-American, 34 years old, who is in the field, who was very upfront in doing the vaccine. And that's her name, and she's right here locally, Dr. Corbett.
Oh, Gloria, you did a wonderful job in explaining this, and I'm truly amazed. And you were very truthful, very convincing, and it came from a person that's not on the top of like COVID virus committee or anything like that. I really think the TV should, get you to educate people, like Channel 4, 5, national televisions. We need more people like you, and you're very good, and they will believe you because you're not part of the, political system, and I truly wish that they would do that. You're very
As I said, this afternoon, I'm going to be interviewed. I forgot what channel. And I've tried to get out there as much as I possibly can, because there is a message to tell. And that's what I'm saying to each of you. Each of you have the message to tell. When you get the vaccine, you have a message, and even now with having your transplant, because there's still so many people who are fearful of a needle. Forget it, kidney transplant.
Yes.
One of the things that I really enjoyed hearing the discussions about is people of color being involved in all phases of the creation of the viruses. And that to me is very important when you talk about the Tuskegee Airmen, where the involvement of the different colors of people, they were not there. So that gives you another sense of security as to the inclusions of the people in the creation of the different phases.
Yeah.
Yeah, don't forget it wasn't the Tuskegee Airmen.
Oh, I'm sorry. I'm sorry. Thank you. Thank you.
Thank goodness.
But the syphilis virus.
Right.
Right. And now what Gloria was saying, I really loved it. She said, if you want to live, you know, you will get this vaccine, you know, and if you don't, then you may not want to get it. She's so right, because I was involved in something like that. Gloria, I'm from India. I'm a Hindu. I converted to Christianity late in my life. Okay. I had smallpox as a child, 3 years old, and my mother did too. And it disfigures the whole face. It took many, many years for smallpox vaccination in India, and many rural areas didn't get it. And when I was 9 or 10, one whole village was wiped out. At least 50 to 80,000 people died. And only people who had that smallpox could go in there and help. And I was a 9 or 10-year-old child. I was feeding little babies bottles because I could go in there. Regular people who didn't have chicken pox cannot go there because they'll die. They didn't have the vaccination. And so many people, you know, were saved by little children like me. And we didn't know, we just gave food or water or whatever it was. And after that, the government of India made it mandatory. Everybody is going to get that smallpox vaccination. And after that, everybody, even up to now, they have to get smallpox vaccination.
Yeah.
And little children were dying, and I didn't know, and it's still big trauma on my head. So I also say, please listen to the scientists, and please listen to Gloria. She's right. If you want to live, get it.
Is it true I heard that transplanted people shouldn't take it?
It is not a live vaccine.
I know.
Transplant patients should not take live vaccines. I think the hesitation is because they haven't had transplant patients in the group of people who were studied.
Okay.
Those who are on dialysis, Dr. Callendar, and those who have cancer treatments they're going through, can they take those?
I don't know about patients who have had cancer treatments because I don't know the whether or not they were involved in the study or not. So I don't know the answer to that question about dialysis patients because I don't know if they had any dialysis patients in the study.
Oh, wow. So I should be a little hesitant?
I just said I don't know. So I'll have to try to research that because the study is valid because the people who they did the vaccinations on represent most of the United States people. But I don't know whether they had any dialysis patients included in the study. And that would give the answer.
I could try to find out for you, Clive, and see. I can't do it today because the Moderna people are with the FDA. But I will. I do know that in the breakdown, they did try to do a cross section of people. So I honestly don't know. And I don't know what Pfizer did. I don't know.
Yeah, I can look it up because they have a paper on it and they will identify the groups of people. But the question is, did they have dialysis patients in that group of people or did they have transplant patients in that group of people? And I don't know the answer yet.
But I'm quite sure there are people who are taking the vaccine now who are kidney patients or on dialysis within the last 2 to 3 days.
Well, that's a good question, because what they do, they actually are giving it to the first responders, and the first responders are not dialysis patients. The first responders are people who are take care of patients, so I don't know for sure that dialysis patients are part of that group, and so
Okay.
you just have to research it and find out.
Okay.
Any other questions for Gloria, who gave us her life story along with her vaccine story, which made it even more touching? Any other questions for Gloria? Also would make a comment that Dr. Walton seems like she's a natural for this group, but anyway.
Yes.
Coming back.
That's his subtle arm twist.
Okay.
No, I love it. Anything I can do to advance the cause, I'm in. I'm all in.
Great. Gloria's going to be busy traveling the country.
Amen. Amen.
Oh,
No, I don't think I'll be traveling the country. Everything's going to be done remotely by Zoom.
right.
Yeah.
Most people are, all of your newscast people, so many people are working through Zoom that Zoom ought to get the Technology of the Year award.
Yeah.
But as things open up, and because there are people who are not going to get shots until 2022 in some countries, because we're here in 2021. But we in America, Europe, and whatnot, we're the first on the front line. And so there are other countries such as maybe India, Africa, and various other countries that are not going to be able to get these shots until 2022. So our voices are still needed out there, because we're fighting against superstition, myths, misinformation, and so you never know what you can say to an individual that makes that lie die right in the shade of sunlight.
Why is her voice so slurred?
Yeah, she has low bandwidth, doctor.
What it is? Okay.
Yeah.
I have what?
Your internet
connection. Bandwidth.
Yeah, your internet connection.
Oh, is there something I can do about that?
No.
Oh, is it the computer?
Yes.
Everybody's computer has a different speed.
It's not really the computer, it's the internet connection.
Router,
It's the speed of your connection to the internet.
Oh, okay.
Your provider may be able to give you information about a different speed, a different router or a different internet speed.
Okay.
Or you might get a better Zoom connection just by connecting on your phone instead of your computer.
That's true.
Okay.
Doc, did you want to look at the articles?
It's already 10:30 according to my thing.
It's 10:29. Yeah.
What is your pleasure? What's the group? 10:30 already.
I'm good to go for another hour. I am.
I have another meeting at 11. So.
Yeah.
Okay, can we look at one article?
look at one and then we'll call it a day. This is the last meeting for the year, by the way.
Oh, well, Merry Christmas, Happy New Year.
Same
Right.
to all, everybody.
Right. Because our next meeting would be in January, right?
Right.
Right.
21.
I need to talk to you. Uh-oh, what happened?
Uh,
I need to talk to you, Dr. Callendar.
You'll have time right after this presentation.
Okay.
Who is that needs to talk to me?
Pearline.
Pearline.
And Dr. Callendar, I do too, but I'll wait an hour and talk to you. You say 11, I'll get you sometime.
Probably after one. I have a meeting from here from 11 to 12:30.
Oh, okay.
Well, I really need to talk to you right away.
Yeah, well, okay. Let's try to get after 12:30, around 1 o'clock.
1 o'clock? Okay.
8 reasons patients don't take their medicine. I thought, even though I know this group takes their medicines, I thought this would be a good idea to look at what they talk about. Fear.
Mm-hmm.
Fear of side effects.
Yeah.
Cost.
Yeah.
Misunderstanding.
Yeah.
Which goes back to the need for when you see the doctor to have somebody with you if it's possible. In the era of COVID, it's tough to have an advocate go with you because nowadays
Right.
they don't let you take people with you, which is
No,
unfortunate.
you can't go in. No.
Yeah, so that's one of the disadvantages. I also saw a study that showed that the incidence of suicide in whites and blacks has changed as a consequence of COVID.
Mm-hmm.
The number of white people who committed suicide is decreased, and the number of black people who committed suicide is doubled.
Wow.
Really?
Yeah, so there's a different impact on blacks and whites when they're associated with being forced to stay at home. It's really taken a tough toll on the black population, regardless of whether it's the disease itself or the things you have to do to try to avoid the disease. So it's food for thought. Anyway, distrust, of course, is something that's always going on, and then worry, well, and depression, why people don't take their medications, but medication adherence is critical. If you're going to get well, you have to take the medication. And so we have to be more sensitive as healthcare providers.
Spray bottle?
All right. Was that a question or a comment?
That was somebody answering the phone.
This is the last one I guess we'll do. 5 reasons why religious services pose high risk of COVID-19. Interesting because the Supreme Court did not like this information. And so in New York, they didn't side with restricting religious gatherings. But anyway, they still shared the information that's in this article and identified 5 reasons why going to church is a problem. And they identified the 5 reasons which you see shortly. Enclosed spaces, obviously, large groups, close proximity to others, staying in one place. Then, of course, the thing that really does it is the loud talking and singing, which are very dangerous. And then, of course, the houses of worship are really red zones. So it's and people who take it to court are saying you're violating my right to religion, which may be true. But what they're trying to do is keep you from spreading the disease and transmitting the disease.
Trying to keep you alive.
Thank you. Thank you.
Well, Dr. Callendar, it also goes with denominations. A Catholic sedate with 1 or 2 people singing versus a Pentecostal or Baptist where everybody is shouting and speaking in tongues and doing spiritual dances, it will be two different type of worship services, and where there's a mass choir with loud singing and
I've-
loud preaching.
I've been to some Catholic churches that have a go-go band,
Yep.
so it's not across the board.
Well, let's say Presbyterians.
Well, the number one denomination that they're really talking about are the Orthodox Jews. Primarily, they're out of New York, and they do not take vaccines for any reason. And recently, about 3 weeks ago, they had a 50,000 gathering in New York City. And the Supreme Court came out with their decision the day after they had this gathering. And so Andrew Cuomo, as well as the mayor of New York, were furious at the Supreme Court because they've been trying to save these people's lives. And they did this service and they kept it from the news. It was a wedding. And they brought people.
This is one of the articles we talked about.
Yeah.
Yeah.
Talked about it last week.
Yeah.
Okay.
Yeah. And of course, the side effects, Gloria has actually talked about the side effects.
She did.
Yeah, that's the beauty of what Gloria has
Right.
brought to us. I don't know, Darryl, are you recording this?
Yes, I am.
Oh, that's great. That's great. Yeah. Okay. All right. I think that we'll. She said the same thing Gloria said. She'd do it again in a heartbeat. So with this, thank you very much, and I hope we meet again next year. And have a Merry Christmas and a Happy New Year.
Thank you.
Everyone.